Welcome everybody to the June learning community for the Maine Network. And we're going to skip like out loud introductions because we do have a somewhat large group. But we would love to have you share your community and or organizational affiliation in the chat. And in a moment, we're going to go ahead and get going. So just a couple of housekeeping pieces, though. We do have live captioning and that from Serena, who's our awesome captioner, and you can access that in the toolbar down at the bottom. I believe you may need to hit more to get to it. If you're having challenges, feel free to ask for help from Kat in the chat. And we will do our best to facilitate today in an inclusive and accessible manner. So if there are things that you need, like folks are talking too fast or not loud enough, whatever kind of adjustments we can make, we're happy to and would welcome feedback. And the last thing is that we do ask that during the meeting that we keep it to one conversation, which will be an out loud conversation, and use the chat really only as directed to avoid having two different conversations. I am not good at tracking two different conversations. I know sometimes people find that fun, but for this, we know that's easier especially for folks who have cognitive disabilities and also for folks who are using a screen reader, because that way they're not getting the chat read out to them while people are talking. So with all that said, I'm going to get us started. We're really excited to be sharing information today from our new report that is Try to Imagine It's You, How Transportation Barriers Are Hurting Maine and How We Move Forward. We are really delighted to be talking about that today and hearing from all of you about it. So Kat, if you want to go on to the next slide. And so we are, we wanted to, start off today by just grounding people in the work that the Moving Maine Network does. And so, many of you are familiar with the Moving Maine Network, but for folks who are not, we really see our work as building an interconnected movement. And what that means is that when we say we, it's all of us. It's all of us in the room, and we really try to go about things in a way that's bringing people's voices into decision making in Maine around transportation. It's a work in progress for sure, but we believe that when we bring all these folks together, we can make that happen, and that's toward achieving the vision of a Maine where all people have access to transportation, regardless of their background, their destination, or their geography. So you can go to the next slide, Kat. And again, I'm not going to get super in the weeds about what Moving Maine does, but I think we've developed, kind of honed this way that we talk about our work, that we're first and foremost about cultivating a community of people who care about this issue, about transportation access. And from that flows support for advocacy and good policy and catalyzing of solutions. You can go on. And so it's important to note that we're not just talking about buses, we're talking about all kinds of quality, affordable rides, whether that's in a volunteer driver program or getting, help through microtransit in the community. And we're also talking about roads. So we're talking about safe, accessible streets and roads that people can get around with outside of a motor vehicle. And we're really focused on a policy and practice level. So we're not operating programs, but we may help to catalyze and start them. But we really want to, through our work, impact the most people possible. Next slide. And so our goals for this session and for this group they're reflective of our overall goals, but we really want people to build relationships and cultivate community within this group. We are, we hope you come away with somebody that you're going to follow up with, or, a new, an organization maybe you didn't know about. We like to share expertise. And so love to hear if you have ideas of folks who should be highlighted, and we can hear about, I actually have sort of a queue running right now. I've heard there's really cool stuff going on in Aroostook County that we want to bring people on to talk about. There's some interesting stuff going on with helping people get driver's ed and afford driver's ed, and help with all the practice hours that you have to do. So hoping to feature that in the fall. And that it moves people to action on transportation solutions. So nothing we love better than hearing that you met through Moving Maine's learning community, and then you did something on your own and made things happen, because that's what it's all about. So I'm going to present some info, and you're hopefully going to ask questions. I might ask you questions. So feel free. That is one arena where if you have a question that you want to put out there when it comes to time, we'll use the chat for that. Then we'll do a little bit of what we like to call carpool conversations, that will be breakout rooms, and really just an opportunity to reflect in a smaller group and make some new friends, maybe catch up with some old friends. And then we're going to talk about what's on the horizon for mobility access in Maine, and some cool things that are flowing out of the really just amazing collaborative legislative advocacy that we were honored to be the facilitators of this this session. So we wanted to start off our I think we're good. Yeah. Or are you going to wait? Hold on, so people don't all start reading it. Kat. Yeah. You want to go back? Okay. What we wanted to do is start off today with grounding us in, thinking about folks who experience barriers and around transportation. And so just wanted to take a moment to invite you to think about someone specifically, and kind of what that looks like for them. And maybe it's yourself, and just kind of bring that person to mind. And we'll just give, I don't know, just like 10 seconds to think about the person for a minute. So thank you for that. So we'll, and I don't, if you want to jot down on a piece of paper, we're actually going to circle back to that when we do the carpool conversation. So if you want to hold on to that, I was thinking about my aunt, who's now passed away. And so I always think back to her and her struggles to get to dialysis. I'm going to have Kat read a couple of stories again to ground us, because who knows, maybe you had a hard time thinking of somebody that so we wanted to share a few of the stories that we collected as like a warm up to this overall conversation.
Thanks, Zoe. So I will read the first story. I'm a visually impaired individual who uses a white cane. I live in an area where access to transportation is extremely limited, and that which is available is very costly to individuals living on disability. The lack of available and affordable transportation for individuals such as myself is disheartening. It makes getting to appointments, seeking medical attention when needed, being social, getting basic needs or wants met, or work opportunities extremely difficult. The impact goes beyond the immediate need individuals are trying to achieve. It affects autonomy, creates anxiety, stress, and depression. And I'll read the second story. I live in rural Somerset County. Our transportation options are either too expensive or non-existent. I currently have a 14-year-old car, and the cost of repairs are very hard for me. It's starting to become impossible for me to keep a car on the road, and that's deeply concerning.
Thank you, Kat. So now we'll jump into talking about the report. And so, first and foremost, we wanted to give a little background of, why we did this, and the what and the why. And so, I think to some extent this is preaching to the choir with this group, but we just are finding more and more over the, going on 8 years of the work that Moving Maine has been part of, that transportation is playing an even larger role in people's lives and their ability to access opportunities in terms of education and employment, medical care, and especially social connections. And so, doing this work, we've been clear as a group that there are many Mainers who are lacking safe, affordable, and reliable transportation. But there hasn't been data that was really specific and went beyond being a proxy measure. So when I say that, I mean, like, we know there's 40,000 Maine households that don't have a vehicle, but some of them probably live in downtowns where they don't need a vehicle, or some of them maybe work from home. So the data is not very exacting. And so what we wanted to do was put together data that got really to the heart of it, of who is experiencing transportation insecurity. And we'll talk more about what that definition means. That's kind of a mouthful. But, we didn't have comprehensive data. And what we found is that then it meant that this issue was getting minimized and overlooked. And so, specifically, there would be conversations with decision makers where we would hear the question, well, how many people are we talking about? And so I think we really saw, the opportunity to address the gap in knowledge. And we wanted to do that both through qualitative stories and quantitative, so having data. And it's a good moment for data. I don't know if you listened to Maine Calling yesterday, but John T. Gorman Foundation also just did a report. All the healthcare systems and the hospitals are now collecting data. So we are making big leaps ahead in data. So I think we were glad to see that the way we did it was complementary to what some others had done, specifically John T. Gorman, in having the stories. So we'll go ahead to the next slide. So in 2024, in fall of 2024, and actually it might have even been a little bit in the summer that we started to collect stories, but we said we want to we want to collect stories, and then we also wanted data. And so we had been looking at this transportation security index tool that had emerged, similar to many more people know about the food security index. So similar approach. We'll talk more in detail about what's in that, but and we said we want to do a survey that's statistically significant, which means that we can look at that data, we can look at the response data, and we can extrapolate to the whole state of Maine. And we also did look at what was available for national and state level transportation and demographic data. So that came into the picture. I think it's, understanding, and this is where there's, some of those proxy measures. I mean, they are really powerful. The number of people without a driver's license, the number of, when you look at car-free households, who's represented there by identities. And then we collected stories. And so couple of things about this. This is the first time that statewide data has been collected in Maine using the Transportation Security Index. the index is quite new and it's really only been in use for the last couple of years. It was developed by researchers at the University of Michigan. And again, it's like based on the model that's used for the food security index. It asks, the full one asks 16 questions, and they ask things like, in the last 30 days, did you have to, cancel an appointment because of transportation? Did you feel stressed out? So it gets at how it gets at these pieces that we can't get at when we look at just whether a household has a car or not. It looks at how is it actually impacting that person? How is it impacting their feelings and their well-being? And so there is now actually there's a couple of shorter versions of the TSI, and there's national conversations about getting it embedded in some of the surveys that happen all the time, like the behavioral risk factor surveillance system. So I think those are things we'd like to see happen in Maine and be able to get that data on an ongoing basis. Go on to the next slide. So again, transportation insecurity, that's a lot of syllables. What does that mean? And so from the researchers, they say it's the condition in which people face material, systemic, and relational issues that contribute to their inability to access needed services or destinations comfortably, conveniently, and affordably. I think part of why we asked you to think about somebody who experiences barriers is that I'm sure as you thought about that person, part of what you thought about was what they're experiencing around, not having convenience, not having affordability, not feeling comfortable. And so those are the parts I feel like it's been helpful as the more we talk about this to really focus on that it's about being able to comfortably, conveniently, and affordably access the things that access transportation that gets you to the places you need to go. So some of the examples of how of symptoms of transportation insecurity, it's missing healthcare appointments or missing getting to the food bank. It's experiencing stress and uncertainty about how you'll get places. It's taking long time to plan out your trips. Anybody who uses the bus or has to get rides from other people knows it takes up time and mental energy because you got to get on the phone or go on the schedule and get it figured out in advance. You can't just like go out to your driveway and jump in your car. And a big one, of course, is limiting the social outings because of not wanting to ask friends or family for additional rides. That one just really always gets my heart, and that's come out in the stories too of people saying, well, my daughter's giving me a ride to my medical appointments, so I don't want to ask her again so I can go to bingo. And, we want people to be able to do all the things, not just some of them. So you can go on to the next slide, Kat. Thanks. So for the story collection campaign, we really we tried to make it as easy and low barrier as possible and say, just, tell us what your experience is, how transportation barriers are affecting your life. And so people could email us, they could text the story, they could submit it through a portal. And then we also partnered with a bunch of awesome organizations, including some folks who are here today, to do these virtual community forums and listening sessions. And that was, another way that people could, there was a time that you could, show up virtually and share your story. And we heard some really powerful stories through that. And then in October, we did an in-person summit And that was, again, that was just an amazing way to bring people together. And I reflect that, like, at the end of that day in particular, there were people who were standing up and sharing stories, and or sitting and sharing stories. Um, and that was, you know, a bit more generative in that people were building off one another. So through that, we ended up with around 300 stories, and then we continue to collect them. And we'll talk a bit later about what we're doing with them, because we were, you know, we also wanted to make sure that it wasn't just like, you know, didn't feel transactional, like give us your story and then go away. And so we really have tried to have it be like an on-ramp to be involved. Next slide. And you know, we asked, I'm not going to read all of these. This is actually like a snapshot of one of the sections of the report. But we asked people, do you have a story about how transportation challenges are affecting your life? And we heard from people all over Maine. As you know, this graphic reflects that, you know, we had folks from, you know, northern counties, southern counties, mid Maine, and all kinds of stories. You know, lots of stories about the cost of keeping a vehicle, lots of stories about from people who are unable to drive and what they're experiencing, stories of people who don't feel safe walking and wheeling on our streets and roads. So, you know, it really covered the gamut. Next slide, thanks. Okay, so now I'm going to jump into the big, you know, the main course here of the Transportation Security Index data. So, and I would just say, if you haven't already found it, and actually, Kat, maybe at some point you can put the link in the chat, but the link to the full report, the full report is on our website, and we do have in the works an executive summary with translations of that into oh, Kat, can you go back to slide sharing? Yeah, sorry. And you don't have to do that link right now if it's too many balls to juggle. But if you go to movingmaiden.org, it's right at the top of our website, the link to it. So we have translations that will be available this week on our website of an executive summary in English. So the big thing is, what we heard is 2 in 5 adults experience transportation insecurity. And that is higher than what we had previously heard for national data, where when they did this nationally, it was 1 in 4. One thing that we did is we included 18 and up, and in the national data, for some reason, they decided not to include 18 to 24-year-olds. And yet we found that they were the most likely group to be experiencing transportation insecurity. And, you know, when you think about that, so it's that's one thing I wanted to talk a little bit about is, so for folks who are working with young people, that won't surprise them. But I think, you know, just sort of peeling that, asking the national folks, the University of Michigan, why didn't they include that age group? And they said, oh, well, you know, it's a transitional time and it can be an outlier and people are in college. And I was like, I don't know. I felt weird about it. And I started doing some Googling, actually. But I found that only 1 in 3 people goes to college. And of that 1 in 3, many of them are low income and probably not living on a college campus. And so I think that just stands out as an arena that we really need to be thinking about and looking at, is how we help our 18 to 24 year olds. You know, not surprising that people who experience transportation insecurity are more likely to be experiencing poverty. So 37% are also, or 37% are living in poverty. more likely to be Black. 85% of Black Mainers experience transportation insecurity, and more likely to have a disability. So we saw that 74% of blind Mainers and 63% of Mainers with mobility disabilities also experience transportation insecurity. We'll go on to the next slide. And then the other thing we talk about in the report that we wanted to focus on today is the connections that we see in the data, and we would love to hear more from you and what connections you see or questions you have. That social isolation piece, that Mainers who experience transportation insecurity are more likely to be stuck at home and to feel left out, and that I think obviously pairs with the isolation crisis that we're seeing. And so, a few of the stats here that, we paired some of the proxy measures with this, that, but that, the TSI data told us that 10% of people are often not able to leave the house. And 12% feel stuck at home. So that's a pretty big piece of the puzzle there. And, and so why is that? I mean, I think so again, I talked before about the 40,000 Maine households without a vehicle. That's a lot of households, and they're distributed all over the state. And they're actually, when you look around the state at the data, it's interesting to see that, there are some very rural places where that rate is much higher. And so that's that 40,000, that's 7%. So we know that older adult households are even more likely to be without a vehicle. So 8.5% of older adult households. The second place where we made connections is around negative health outcomes. So we did add to our survey a question about people's health status, and so to self-rate their health status in terms of, poor to good. And so we did find that 9% of people who experience transportation insecurity also they would rate their health as poor. And so it doesn't take much to connect that, there's also like such a large percent who say they have to reschedule an appointment, often have to reschedule a medical appointment. So again, some of the bigger picture data that we paired that with is seeing that 20% of Mainers live in an area where they need to travel 30 miles or more to be seen by a primary care provider. So, a lot of people that they're going to have to get a ride. There's no option for walking. I mean, I don't know if you're like a marathon walker, maybe, but for most of us, that's not going to be a reality. So go on to the next slide. And so then the third piece theme that we pulled out from the data is the lack of economic opportunity. And I think this is pretty startling data, this piece of it too, that Mainers who experience transportation insecurity are more likely to be unemployed and less likely to own a home. And, we can't say why exactly that is. That would need more work, but part of what we think is that it's the outsized, the cost of vehicle ownership taking up such a big chunk of people's income, is one piece of the puzzle that we see. And then also that if you can't drive, what that means for your ability to be employed, your ability to, get the income necessary to make those investments. And something that I think is another really impactful piece is that in general, so these pieces like the buckets to the right, where across incomes, transportation spending accounts for a third or more of family budgets. So that's, no, we're not even talking about folks with low incomes. We're talking about across incomes. And so one piece of data on that is that Maine households with two parents and two children spend an average of 28% of household income on transportation. And that's just way out of whack of what it should be. Um, and and that average spending is higher in our most rural counties. Again, not surprising, but just like, whoa, that's a lot of a family income. Like, what's left after transportation and housing costs? So, and this data, this final piece of data on this slide, the cost of vehicle ownership. So in 2024, the average was just over 12,000, which was already a 30% increase from 2020. And I haven't seen the new data, but I mean, we all know that the cost of car ownership has just continued to go up. Next slide, please, Kat. So all this data, and I'll wrap up with my part talking soon, and we'll get into questions and discussion. But part of what we did with this is we said, okay, well, what does this mean for Maine? What does this mean? What is, as the Moving Maine Network, how do we take what we heard and make recommendations to decision makers, and translate that into, legislation, into our policy work. And so we distilled it into 6 buckets, if you will. And so these are our recommendations, and they're also pieces of, we talk about this as what Mainers are asking for, what Mainers want. And so these are now pieces of what we're working on. We know many of you are working on these in different ways as well. And so the first one is easily accessible mobility information and support. And so that is a piece that people continue to feel that they don't understand. They don't necessarily know all that is available. There are resources. Sometimes it feels like there's too many places to look, and many people want a human being who can help them with that. And so, that's part of why we've been championing increased availability of mobility navigators across the state. And, for the folks who were here when Lisa Smith presented about being a mobility manager in Aroostook County, it's like every county needs a Lisa. And Larry, who's here today, is working in York County, and every county needs a Larry or a Lisa. We can do like a poster campaign. Are you good with that, Larry? And that is a person who they can talk to, who might show them how to use the bus, talk to them about what the options are. Larry and Lisa's jobs are a little bit different, but I think the point is we actually need both. We need a Larry and a Lisa in each county. Like somebody who can help you with like the hands-on of getting to use the public transportation and community transportation options. And then somebody who also, like in Lisa's case, jumps in and writes a grant proposal to Maine Cancer Foundation to provide new transportation. So that's something we're working on. And this sort of like, it's a good segue that, we need more cross-sector coordination. And this shows up like, for Moving Maine, we talk a lot about coordinating to do coordinated planning and, solution making and shared funding. The other piece of that we heard a lot from people is they want the systems to talk to each other. They don't want to have to call one number for one type of ride and a different number for a different type of ride. It's confusing. It's discouraging. They want it to be that there's one number to call, and and then they can get like routed to the appropriate service. The third one here is people want a real voice in transportation decisions. So I think one thing like that we're navigating with doing this is like people have been asked this a lot. And so there's definitely a sense of like, okay, I'll tell you again, but when is somebody going to fix it? And so I think what we really tried to do is say yes, we are asking you to tell us again and join us in making solutions happen as we go forward and bring your voice into the process. And part of that is to have more ways for people to have people with lived experience and people who work in caregiving roles and social service roles know so much about what the solutions need to be and how they need to look and how do we have them more meaningfully involved in decisions. Next slide, Kat. So these are the last three of our buckets. So ongoing support for community-based solutions. And so, we talk about mobility management programs that, it's not just about helping individuals, it's about helping the community to keep going with their often what the most efficient and accessible and sustainable solutions. So, making it easier for communities to keep doing their volunteer ride programs, to keep doing their locally grown solutions. Communities want help with that. They want to know that that program is going to stick around and be available in the long term. And there's a way that we think it's a great investment for the state to invest in helping communities keep doing their locally, their community-based solutions. So second to last one, safer walking and wheeling. And I think this is just, comes out in all these different ways. And the piece that Moving Maine works on is really focusing on folks who are walking and wheeling because that is their transportation and because they can't drive. And so that's this unique piece of the puzzle that I think we're trying to be a voice in conversations that, okay, recreational trails are great, and let's make sure they're accessible to folks who are using wheelchairs. Let's overall have a larger investment in safe and complete streets, which would make the connection so people can walk and wheel for transportation. And I'm just realizing this last one has a typo in it, but it is more and better public and community transportation options. And so that's basically like, we need a larger investment in community transportation for Maine. Currently, we spend very little compared to what is spent on like the overall transportation budget. There's about 80% of it that goes to roads and bridges. So we think there's more that could go to, public and community transportation and walking and wheeling infrastructure. We're not saying that we don't keep the roads up. We need the roads for the buses and the volunteer drivers to drive on. We just think we need to increase the investment. And part of that too is making the best use of our Maine Care transportation dollars in Maine. So making sure that $10 million a year that comes into Maine. I'm getting that amount wrong, sorry. But it's a lot of the millions of dollars that making sure that money that comes into Maine actually does provide the best outcomes for Maine people and communities. So next slide. So before we get into Q&A and then a little bit of carpool conversations, we just wanted to talk about how the stories and data are influencing change. And I think there's two parts to this. And one is it really is helping to shape a new narrative to support transportation policy change. And so, we were able to share this report with all the members of the legislature's Health and Human Services Committee and Transportation Committee. And and it was also included in the Public Transit Advisory Council's 2025 report to the legislature. So, getting that information and the stories in front of decision makers, we've found, we've heard reactions to it that they found it compelling and useful. And then that the stories collected are enabling us to elevate voices, which is, clearly one of our goals, that we were able to follow back up with people who submitted a story and say, hey, your story really is relevant to this conversation that's happening in this community. Would you be willing to show up to the council meeting and talk about your experience? Would you be willing to show up to the legislature and talk about your experience? And we think that does two things, in that it really has people feel validated that their voices mattered, and for decision makers hearing it directly from people themselves, not through a professional, not filtered, but really directly from the people. Next slide, Kat. So this is actually, yeah. So we're so that's sort of our closing up for the day of how you can be involved, and we'll do that in a little bit later. But yeah, so what we wanted to do now is open it up to if folks have any questions they wanted to ask or comments. And then after that, we'll go into the carpool conversations. And so we would just say, throw up your virtual hand and unmute yourself, and we can take some questions and comments.